Hello, everybody. I don't know if everybody is able to understand what I'm saying. I'm going to have my speech in Kinyarwanda, so to allow everybody to be able to understand what I'm saying. So ndagira ngo nanone mbashimire abantu bose mwafashe akanya kanyu mukaza muri iyi conference yabaye organisée par l'association Humura. Ndabizi yuko it's beautiful outside, it's Saturday afternoon. Mwari mufite ibyishimo mushobora gukora uyu munsi, ariko kuba mwafashe akanya kanyu ko kuza muri iyi nama nako muri conference ntabwo ari ikintu dufata likely, tuba tubibashimira rwose, for granted, tuba tubibashimira kuba mwafashe akanya mukaza muri iyi conference. Nk'uko mubizi, Humura Association mu byishinzwe en particulier rimwe muri misiyo yayo ni ukukipinga memory y'abantu bacu twabuze muri jenoside mu 1994 alive. Ariko nk'uko mubizi, abantu benshi barokoze jenoside yabagize ingaruka nyinshi cyane, ariko siritu ingaruka zitagaragara, icyo dukunda kwita ngo ni mental health. Usanga umuntu nyuma y'imyaka igera kuri 30 bagifite izo consequences za genocide, especially on their mental health, nk'uko mubizi rero, Humura mwe muri initiative yafashe ces 2 dernières années ni ukwiyokipa vraiment ku kibazo cya santé mentale mu buryo navuga ko ari nk'aho ariyo misiyo yacu ya kabiri, apart gukipinga memory alive y'abantu bacu, surtout mu kwiyubaka. Tugomba kwiyubaka do taking care of our mental health. Diane Roma, uyu mujene mubona kuri screen yanyu, Ryan, ariwe ampasa ubu ngubu usigaye uyobora initiative ya mental health muri association Humura. Pasiri tukari ibintu ari passionné murimo, anabirangijemo resama. Ngira ngaza kugira umwanya wo kwipresenta na equipe yiwe. Ndaza kubashimira at the end, mvuga timu yabo. Right now ntawe ushaka gufata umwanya munini cyane, ariko iki kibazo cya taking care of our mental health ni ikintu dufashe cy'ingenzi muri Humura, kuko na Diane Roma simba n'umwayibonye abasha kubona information. Ubu twatangiye une collaboration avec le Jewish Family Services Organization. Ni l'association y'abajuif hano muri Ottawa, yita ko tout ce qui vie sociale y'abamambure bayo n'abantu babagana, ariko surtout bakaba bibanda cyane kuri mental health. Ni collaboration igitangira, ariko nababwira yuko vraiment twifuza kandi tubona ko izagera kure cyane. Deja na semaine prochaine dufitanye inama nabo, twabonye barimo baradufasha kudevelopa porogaramu yacu, barimo baradufasha kubona financement ya porogaramu zacu, ku buryo vraiment ntekereza yuko iki kibazo cya santé mentale muri community yacu mu myaka iri imbere tuzaba twakiboneye uburyo kuko duhana example n'abandi bose, ko nabonekeza ko ari abanyarwanda bonyine esirita barescape bafite ikibazo cya santé mentale, yuko pas mal d'immigrants qui arrivent ici au Canada nabo bafite iki kibazo cya santé mentale. Gusanga nous les Africains twacyari muri level to educate ourselves. So ndafashe umwanya munini cyane, nkaba nagira ngo mbahe abapanelista bacu, surtout MC wacu atangire ikiganiro cyacu ngo twabemereye, ntago turi batindire. Ijambo ni ryawe, Diane.
Thank you, merci Pascal pour me donner la parole. Donc, je vais commencer un peu en français, but like most of the conference today will happen in English. So before we start, I wanted to thank Humura Association for organizing this, and also Pascal for your message. And before we even start with our wonderful panelists and this very important discussion, I really wanted to take the time to do a land acknowledgement. So I wanted to take the time to do this. So we gather here today on a traditional unceded territory of the Algonquin Anishinaabe Nation. We acknowledge and honor the First Nation Inuit and Métis people who have been the steward of this land for millennia. As individual from Rwanda, a nation with his own history of colonization and displacement, we understand the profound impact of land disposition and the importance of respecting the sovereignty and resilience of Indigenous community. We recognize the enduring connection of the Algonquin Anishinaabe people to this land and express our gratitude for allowing us to gather and work in their ancestral territory. We commit ourselves to learning from and supporting the ongoing struggles for self-determination, cultural revitalization, and justice of Indigenous people, not only here in Canada, but around the world. In the spirit of reconciliation and solidarity, let us strive for a more just and equitable future for all who call this land home. So with this, I really encouraging you, before we move on, to actually take the time to learn more about the Indigenous people, wherever you are from the world. So I'm very happy and honored to be here with all of you today and to have this very, very meaningful conversation. As I think Pascal have mentioned, it's something that is very important to mental health is something that is very important in our within our community. So I wanted today's theme is around intergenerational trauma. So I just wanted to kind of do a little introduction of our team today before moving and presenting starting our panel discussion. So wanted to introduce explaining a little bit more what is intergenerational trauma, and then moving forward with our schedule for today. So intergenerational trauma in the Rwandan community referred to the transmission of psychological stress and emotional wounds from one generation to the next, often stemming from the traumatic experience endured during the Rwandan genocide in 1994. This profound collective trauma has left lasting scar on survivors and their descendants, impacting their mental health, emotional, and social well-being. The trauma manifests in various ways, including pervasive feelings of grief, survival guilt, anxiety, and even post-traumatic stress disorder, PTSD. Addressing intergenerational trauma in Rwanda involves providing therapeutic support and resources to individuals and families, acknowledging the historical context and fostering healing and resilience within the community. So today we have the privilege of being joined by 4 esteemed panelists. Well, they included me in this, and all of them being women of our Rwandan community who dedicated their careers to combating intergenerational trauma. We are also joined by an elder of our community, Bernadette Muhimakazi Bugingo, who has offered to give a short testimony on how she has seen the transmission of trauma across 4 generations. So before this, I would like to invite, I think, Umura Association have already spoke about the project that's upcoming. So right now, I'd like to invite Bernadette Muhimakazi Bugingo to be to open her camera, and I'm gonna introduce her with a short bio to introduce Bernadette before she provides us her testimony. So Bernadette Muhimakazi Bugingo est née le 30 janvier 1947 sous le règne de Mutara Rudakenga et sous le régime colonial de la Belgique. Les premières vagues de violence à l'encontre de Tutsis l'ont contrainte, elle et sa famille, à s'exiler successivement au Congo et au Burundi. Elle reviendra au Rwanda en 1994. Elle réside au Canada depuis 13 ans. Donc, ce témoignage de Bernadette sera fait en français et par la suite, nous continuerons la discussion avec nos panélistes en anglais. Bernadette.
Murakoze. Je croyais faire ma présentation mu Kinyarwanda. Je ne sais pas si vous l'autorisez.
Il n'y a pas de problème, c'est dans la
Okay.
langue. Votre
Yeah.
choix. Je pense que ça va avoir encore plus d'impact.
Mushake ababa tradurise. Murakoze rero arababwiye uwo ndi we. Ngira ngo mu bantu bakuze muri communauté yacu ndi muri bamwe bakuze, sinzi niba hakiri benshi de ma generation, bikaba ari privilege yo kuba nababwira muri make ibyo nzi, kuko urumva navutse kera mwese mutarabaho. Ndashaka kubivuga mu bice nka 4. Iyo trauma abahanga bazo les spécialistes baraza kubabwira icyo ari cyo, ariko nge nibaza ko trauma ari reaction y'iyo uhuye na shock, igaterwa nuko shock ibaye ikomeye. Yeah. Uko shock ibaye ikomeye, uko shock ibaye utayiteguye, utari witeze, mbega nk'uko ushobora kugenda ugakubita umutwe kuri mur kuko utari wayibonye, mbega biterwa na byinshi cyane n'uburyo bwo kwihanganira ufite. Avuga rero mu mateka, mu magambo make, reba mu bice 4. Hari u Rwanda rwa kera rwa mbere y'abakoloni. Muri icyo gihe abanyarwanda bari bafite uburyo babaho, bafite indangagaciro zibabanisha, akenshi bakabana mu mahoro. Izo ndangagaciro zahererekanywaga mu burere, ababyeyi bagendaga baha abana, umwana agakura azi indangagaciro z'iwabo, agakura azi kirazira, uyobye bakamuhana, ariko mu rwego rwo kumugarura muri sosiyete, zazaba ngombwa cyane gake bakamuca. Zo bita guca umuntu, ni ukuvuga ko yabaga yananiranye, aho kugira ngo asenye sosiyete we bakayimukura. Mu ndangagaciro zimwe navuga nk'ikintu cyitwa kwihangana, kuterekana amarangamutima cyangwa ibyo ukeneye, kutandavura, mbese kubaha umuryango, kubaha abakuru, ukaba wakwitangira n'umuryango, kudashyanuka. Ibyo byose byari indangagaciro bahaga umwana, agakura abizi, agakura azi kirazira, ntabe yayirengaho, bigatuma abantu babana mu mahoro. Haduka umuzungu muri colonisation. Ntabwo nayimenye ikiza, ibyo ni ababyeyi bacu bahuye n'uwo muzungu. Aje aza urukomansi yerekana ko umwirabura mbega atari umuntu wuzuye. Amutoza kubaha umuzungu, akaba yasuzugura n'undi mwirabura. Nabaha ingero ebyiri gusa, urugero rumwe rwa rusange n'urugero personnel. Icyo bitaga ikiboko kwari ugufata umuntu w'umugabo mukuru w'umubyeyi responsable mu rugo no muri communauté, kuko yakoreye icyaha umuzungu, bakamuryamisha hasi bakamukubita. Ibyo bintu ntibyabagaho. Umuntu mukuru agakubita undi, kandi bakiyaranja kugira ngo umunyarwanda abe ari we ukubita undi munyarwanda, bikemerwa, bikaba ari ibintu bisanzwe. Urugero personnel nababwira, ndi umwana w'imyaka 7, imbwa y'umuzungu wari data, shebuja wa data, yarandiye. Aho kugira ngo bavuge bati ibi ni ibiki iyo mbwa ikuriye, ahubwo twarabihishe, kuko ahubwo uwo muzungu niwe wari kuduhana ko imbwa ye yari yandiye. Murabyumva? Donc imbwa y'umuzungu yari yubahitse kurusha umwirabura. Mbega umwirabura rero kugira ngo abeho neza abane nabo yemera guca bugufi, yemera amabwiriza, yemera ayo mabwiriza, yemera guca bugufi, yemera kwisuzugura no gusuzugura undi mwirabura. Ndetse haje kuza icyo bita imvuruwe, ni ukuvuga uwageragezaga gusa n'umuzungu bakabimwubahira, agahabwa uruhushya rwo gusangira nabo rimwe na rimwe no kubegera. Abantu rero batangira gushaka kuba imvuruwe, ni expression ya evoluwe, no bagerageza. Muzi ko mu nyuma haje no kuza abantu bashaka kwitukuza uruhu, ko babonaga ko kuba umuzungu ari byo bizima, ari byo byiza. Ariko ababyeyi bacu rero nibo bahuye n'izo mpinduka. Tuvuka bakiri muri iyo direme, indangagaciro zacu bakavuga bati ibyo ari byo zose nizo nziza, bakagerageza kuzitwigisha rimwe na rimwe, ndetse bakazitwigisha rwihishwa kugira ngo nyane umuzungu atarakara. Ibyo biza guhita tujya muri repubulika turigenzi. Noneho ziza zihindura neza neza imibanire y'abanyarwanda. Hemezwa yuko hari igice cy'abanyarwanda badakwiye kuba mu Rwanda, cyangwa se bakahaba badafite uburenganzira bungana n'ubw'abandi. Byo bisa n'ibigiye no mu mategeko byemerwa. Kugira ngo babeho bamwe barahunga. Murumva iyo shock yo guhunga, uhaguruka ukava mu rugo rwawe nta usanze, nta utazi naho ugiye. Iyo nayo ni shock ikomeye cyane, cyane cyane kuri ba babyeyi bahoze ari responsable, bazi ko ari bo ba nyir'urugo, akiroturuva mbega ntacyo ari cyo. Bagenda barwana uko bashoboye, bamwe babaho abandi birabahitana. Ariko murumva deja iyo shock uko yanganaga. Abasigaye nabo batahunze directement basigara mu Rwanda, ariko bari abanyarwanda b'igice. Nabo kugira ngo babeho bakagerageza kuba invisible, mbega ntugaragare. Ugiriwe nabi ugaceceka, ugiriwe neza ugasanga ari igitangaza utari ubikwiye. Bigeraho ubuzima biba imyaka yose abantu bumva ni ibisanzwe, niko bigomba kugenda. Ntawigeze agira ati ibi bintu ni ishyano. Noneho haza 94, byo biza ari karandura. Za kirazira zose zivaho, hakorwa ibintu bitarabaho, sinabibibutsa abari bihari. Yewe na bwa buryo bwo kwirinda ugerageza kuba invisible ntibwaba bugishoboka. N'uwari invisible arashakishwa kugira ngo apfe. Nta mekanizme n'imwe yari igishoboka kugira ngo umuntu yirwaneho. Noneho rero abavuye muri ibyo ari ababibayemo directement, ari n'ababibayemo bari hanze babireba ku makuru, buri wese hari ukuntu iyo shock yamugezeho. Hari abagendana ibikomere, akagenda asa naho ari muzima ariko mu by'ukuri atari muzima. Hari abababwira bati jyewe icyatumye nsigara n'icyo, ugasanga afite iyo culpabilité. Izo murabizi ni mwebwe muza kubitubwira. Reka rero noneho nyuma y'iyo jenoside icyahindutse, haza iyindi evenema yo kuza mu bihugu by'amahanga. Umubyeyi tangiye gushira impumu ati ba bana banjye bagejeje mu bihugu by'amahanga ntibagipfuye. Yizeye icyo, ariko za ndangagaciro zatwubakaga ntiyazisanga muri cya gihugu bajemo. Ari wa mubyeyi waherekeje wazanye n'abana, igihe akirwana no kumenya uko bacana micro-onde n'uko batega bisi, umwana we ari mu yindi sosiyete imubwira ibitari bya bindi ababyeyi bamubwiye. Mwereka ko agomba kwerekana ibye, agomba kwerekana emotion ze, agomba gushyanuka, ndetse mu gihe wa mubyeyi akiri mu kurwana n'ubuzima busanzwe. Noneho hakaza na ba bandi, mbabarire ntabwo nzi uko bigenze, muracyanyumva? Biranshitse. Reka nkomeze mvuga. Hakaba abo bazanye n'abo bana bagahura n'iyo shock. Ababyeyi bafite shock yuko ibyo bari bazi ko bazigisha abana atari byo sosiyete bigisha. Abana nabo bakagira iyo shock yuko basanga ababyeyi babo basa n'abanyuranyije n'igihugu babazanyemo. Hari na ba bandi rero babohereza bonyine, umubyeyi akavuga ati Imana umwana wanjye aje muri Canada, ibintu bigenda kumera neza. Ya sosiyete umwana ajemo ikaza imubwira ibitari by'umubyeyi yari yamubwiye, nanone hakaba iyo shoke. Nguko uko rero bamwe bashobora kugira imyitwarire tudashima, abandi bagahungira mu biyobyabwenge, abandi bakajunjama n'ibindi bimenyetso byose mwebwe muzi byo guhahama. Mbese muri make twagize impamvu nyinshi zo kugira trauma, igenda ikurikirana generation, kuko buri generation icyo yagombaga guha iyikurikiye hazaga ikintu kiza kuyikoma mu nkokora. Birakomeye, ariko ahari ubushake hari n'abantu ndibaza ko muzagerageza mwebwe abakibashije mukarwanira kongera kuba abantu bazima b'Abanyarwanda b'Abanyakanada memta. Nibyo mvifurije, murakoze.
Merci beaucoup, Bernadette. Thank you. So I think I wanted to kind of take a few minutes to recap the best way I can what Bernadette has shared with her story, and have had the courage to bring to our attention. Like Bernadette went over, and I'm going to recap, and hopefully I give justice to the testimony, because for some people that do not understand Kinyarwanda or just get a few words, I think her testimony have more impact in Kinyarwanda because there's some words that are more powerful. Bernadette explained how she have seen intergenerational trauma, having been born in 1947, having had the impact of, she talked about the impact of the colonization on the Rwandan culture. So she talked about how when when she was a younger girl, the impact of colonization and how the colonizer came to Rwanda, and with their whole mentality of the Black people being kind of like second-hand citizen, and some of their teaching and how they view like the Black people, and how it had impact into the way some of our people will see themselves, and also how it impact like the colonization had a huge impact on her, and with how she have seen the story, and how some of the from our history, how the violence and the first les premières vagues de violence, excusez pour le dire en français, contre les Tutsis quand ils sont arrivés au Rwanda, like how they created some shock with some of our community, and with the impact of colonization, a lot of the trauma and the shock that was experienced from the Rwandan people were internalized. We were taught earlier on to kind of like keep it in together, keep it inside, and not really make wave about some of our emotional emotional well-being. There was also, she also explained how the trauma and the shock that have that had impacted and that were impacting some of our people, because with everything that was happening, and forced them to exile and go outside and live across the world. And after the genocide, how with everything that we're internalizing, the shock and the trauma, there still has been within our community a sense of like, we're not talking about it, we're not addressing it, we're not addressing some of the trauma and how it shows up with some of our people, and how like the more we go, the more it has an impact on on our community. And one of the things that she had mentioned is like the importance of talking about it and having a conversation and educating ourselves to be able to restore a little bit or heal our community, because from her eyes, being an elder, she's seen how trauma have shown up in our community from early age with the colonization, from the exile, from before the genocide and after the genocide, and also the impact of some of our people when we go outside and having to reconcile immigration, like going outside of Rwanda and coming back. She went a little bit over that. So I apologize if I'm not necessarily recapping it the best way I could, but I wanted to bring a bit of the point that she had mentioned. So we will, without further ado, I think we will continue this conversation with our panel of experts here and have a little bit more of a discussion and understanding what is the intergenerational trauma, and have our expert also bring their expertise about this topic and what they've seen, and to help support our community and have more discussion about trauma, more discussion about our mental health and our well-being. So I will start by introducing our panelists first, and then we will start with a series of questions, and we'll have a period of Q&A for all of us. So first, I would like to introduce Dr. Lydia Ndejuru. Lydia, can you say hi? So, Lydia Ndejuru holds a PhD from Concordia University, Montreal, and is a licensed psychotherapist with certifications in Moreno psychodrama and third-party neutral conflict resolution. She is a skilled practitioner of playback theater and a co-founder of the Montreal-based Living Histories Ensemble. Born in Rwanda, she has served the Rwandan diaspora in North America for more than 25 years as an organizer, researcher, and activist. She has experimented extensively with storytelling, plays, and improvised theater. Her work is focused on individual and collective meaning making and empowering for Black communities in the aftermath of large-scale political violence and the trauma and dislocation of our lives. So Lydia will answer a few questions. And we also have with us today Lydia Nimbeshaho. Lydia, can you say hi?
Hi, everyone. Thank you. Thank you for having me.
So happy to have you. Lydia is passionate about sharing knowledge for hope and restoration through Beyond the Veil Mission, a nonprofit organization established to help bridge the gap between mental health and wellness support for Rwandans, African, Caribbean, and Black people in Canada. At the age of 6, Lydia witnessed the murder of her parents in the Rwandan genocide against the Tutsi. The difficulty she met at a young age ignited her compassion to impact lives and effect positive change through education and the sharing of people. Lydia brings awareness to childhood, genocide, and intergenerational trauma, and advocates for a safe space for those experiencing mental health challenges. She collaborates with various stakeholders to create social programs and facilitate training, retreats, mentorship, and other healing initiatives for the Rwandans and Afro-Black communities in Canada and the diaspora. Lydia holds a BA honor in sociology and sexuality studies from York University. She is pursuing a Master of Divinity in clinical counseling at Tyndale University in her final year, and is currently a psychotherapist qualifying. Lydia, we're happy to have you here. So our next Our next panelist is Bernadette Ngabonziza. Bernadette, can you say hi?
Hi.
So Bernadette Ngabonziza is a board certified psychiatric mental health nurse practitioner. She received her Master of Science degree in Advanced Practice Nursing from New York University with an Outstanding Student Award, both academically and clinically. Bernadette Ngabonziza has 15 years of clinical experience in various areas, including transplant and psychiatry in both inpatient and outpatient settings. She has been with Veterans Health Administration for over 6 years and has worked with veterans with post-traumatic stress disorder at VA New York Harbor Healthcare System. She currently functions as the Director of Workplace Violence Prevention Program and the Chair of the Disruptive Behavior Prevention Committee while providing treatment to veterans with opioid use disorder. Before joining the Veteran Health Administration, driven by finding solutions, Bernadette Ngabonziza conducted research on observed increase in use of synthetic cannabinoids in patients with mental illness at Westchester Medical Center and contributed to the clinical care of the patients. She has presented her findings to nursing conferences and to the medical students at New York Medical College. So we're very happy, and we're very happy to have our panel of experts here and dive into this discussion. I will ask a series of questions to our panelists, and we'll have sometimes to have a Q&A. If you want to send some of your questions in the chat, feel free to do so. So we will start first with Dr. Lisa Ndejuru. Lisa, I call her Lisa. So, Lisa, can you explain what intergenerational trauma is and how it affects individuals and families? Lisa.
So I wanted to share. Yeah, can you hear me? Can you hear me?
Yes.
Yes, you can hear me? Okay. So I brought a picture of a really pretty sort of like c'est un joli champ in Rwanda. It's a picture that we took in 2011, and it's something that I use when I'm thinking about intergenerational trauma. It's something that I've been that I had with me when I was doing my PhD, writing about. So this pretty field was what I was told, where I was, my uncle brought me to this field, and he said, this is where it is said that your grandfather was thrown when he was assassinated in 1962. And so what you see all these years afterwards is a pretty field in the sunshine. There's no one who can say what happened there, right? And the family today, if you look at the family, it's like this pretty field. You can't see on the outside fairly what is happening underneath. But if you, let's say, at one point we realized that my generation of people, so my grandfather was killed in 62. There was my father's, so his son's generation who had done everything right, everything that they could, they were all the things. And yet my generation had trouble making it in the world, like had trouble sort of becoming, like stepping into adulthood properly. And when we played with my whole my extended family, when we played with psychodrama, we realized that the family had organized in a way after the assassination, that this assassination that nobody was talking about it, right? But it was very, very large, and everybody had organized inside of our family, and people had allowed them to keep going, but that didn't necessarily allow us as a family to thrive. And so it was a really interesting way of playing, quote unquote, with how can I say that? Our relationship, how we were connected to each other, and to sort of even things out and open things up, right? So from the outside, you can't tell. It's a pretty field. But if the field could speak, tell stories. And this is one person is at a scale so that it is so much created all these ways of compensating. During the genocide, there were so many, right? So what I meant by this, or why I brought this picture, is to bring to us how much of it is there. We live with it all the time. And when we think about, like, the way we live with it often is in silence, right? We don't necessarily speak, but it has effects in our life. So intergenerational trauma or transgenerational trauma is the transmission of trauma from one generation to the next one. The first may have directly experienced it and may inadvertently pass it on to their descendants, right? And the legacy is going to manifest in different ways. So it can be altered behaviors and worldviews inside of the family or even the larger community, right? Like, for example, in trauma, often we don't trust in the same way as other people do, yeah? Patterns of avoidance happen a lot, right? Evading discussions about the difficult past or maybe specific family members. And this can be because it's difficult, because there's just so much of it, and because you want to protect the youth from it, because there's all kinds of reasons why we may keep silence, right? There can be persistent and unresolved grief, right? So people can hold these for a whole, unresolved, and for a long, long time. And it creates really complex emotional landscapes, right? Like, for example, my grandfather's, it is said that the body was there, but nobody saw it, right? And so it leaves, like, this is something that happens a lot, and that happened again and again, where people lose their love. You don't find the remains. You can't have closure, right? And so you have these people, like my father, my uncle, even like 40 years later, thinking maybe they will meet their father again, right? Like maybe what if? And that sort of that unfinished, unresolved pieces, right? That are not necessarily questioned. And in our, so I'll continue. There's detachment in relationships sometimes, or maybe overprotection in parenting styles. There can be mental health challenges, depression, anxiety, PTSD, etc., as Diane already said. In our community, just like for the indigenous people of Turtle Island and across the world, intergenerational trauma is complicated by historical trauma of colonization, personal and systemic, right? And so it affects communities, and it trickles down. It infuses daily lives and relationships with layers of complexity. In the diaspora context, we have to also consider the interplay. Is another form of forced migration, and each are formidable challenges on their own. And when trauma layers onto those processes, it can further complicate the individual's journey.
Oh. Lisa.
So, yeah.
We're just having a little bit of trouble. I think, I'm not sure if I'm the only one. It was cutting off a little bit.
You didn't hear me?
No, but it was just cutting off a little bit just
Oh,
with what you were just saying. So I wanted to ask if you can.
sorry.
Can you hear us?
Do you need me to repeat?
Yeah, just the
I
last.
can hear you really well.
Okay,
Do you
just the
need-
last part. I was just wanted to let you know.
Which part? Like, I think that I think what is important for us to know is that there is trauma. There's historical trauma around colonization. There is the trauma of forced migration, often migration, adaptation, exile. There are added layers of complexity in the situations that we are facing as a community. Yeah, and so when we are wanting to work with trauma, it's important to really listen to what is going on, right? Even like we can say the genocide and it's like an event, but what is important is the unique experience of each person or of each group, and it's going to play out differently. And it's not because something has been difficult for one person that it's going to be difficult for the other person. And so it's not always useful. It is useful to know that there is such a thing that you can transmit, right? Like there's something that you receive. And as the younger people who haven't actually lived this experience, it's often strange to think, why are we struggling if we haven't lived this thing? They've given us, and we'll be told, we've given you everything. What are you suffering from? You haven't experienced anything, right? And what we need to remember, and this is something that happens here in Rwanda. I'm in Kigali right now. In Rwanda, you have parents who are looking at their children going, why are you struggling? We've given you everything you need, right? And it's the same kind of questions that parents have in Canada when like first generation immigrants say to their children, what are you struggling for? We've given you everything you need, right? So there's an intergenerational something. There's trauma in it, but is it only that? So it has to be, nobody struggles on purpose. If the youth are struggling, it's that there's something there and it needs to be heard, because nobody wants to struggle, right? We all want to be well. And I think that we need to listen to that really, really carefully. Voila. I'm going to stop.
Thank you, Lisa. And I like how you brought nuance and explain the complexity. And it kind of goes with also what Bernadette had shared about her testimony of how she has seen intergenerational trauma going across different generations. So thank you for this, Lisa. So I will actually ask the next question to Lydia. Lydia, based on your experience in counseling, what are some recurring challenges or concern frequently encountered within the Rwandan community?
Oh, yes, Diane, thank you so much for that question. And also thank you for giving me this opportunity to share my experiences. And I'm so grateful to be here with my community. This question, I think I will speak about it in two contexts. When we talk about Rwandan community, there is the community we have in Canada, and also there's the community we have back home. And I believe that the challenges we face either back home or in Canada, they impact us either directly or indirectly. So starting from the challenges we face in Rwanda, because our organization Beyond the Veil operates in Rwanda as well, in Huye, Butare. I think I will start from the general challenges, but I will conclude with two important challenges that are often dismissed or maybe not talked about a lot. And I think it's one of the reasons why we have to question and I would say even restructure ways that we are trying to find solutions in terms of mental health practice. And so starting from the Rwanda, I think some of the general challenges, we can talk about poverty, unemployment. Those are the things that can really impact our community, trigger depression, anxiety. I think there is a say, but it's not even a say. There is research that says that tell me your socioeconomic status and I will tell you the level of your mental health. It is very difficult to separate the two when we try to help people who seek mental health, especially who are experiencing poverty and unemployment. It can be so difficult because in counseling practices, first thing is to ensure that people are safe, people have the basic needs, and really supporting people who are experiencing poverty, that can be very difficult. And I think this can apply not only in Rwanda and in Canada as well. When you look at the issues that Rwandans face in Canada as well, poverty is one of them, unemployment as well. People may come from as other immigrants from Rwanda with different degrees. When you get here, it's another story. You have to start all over again. So another general one that we know might be, the PTSD and mental health problems as a result of the genocide against the Tutsi. This one, I think most of us are familiar, and I believe this is one of the biggest work of Humura Association while we're here. The other one that I believe we don't talk about it a lot as well, especially for the Rwanda side, is the HIV and AIDS impact. When you look at by research, HIV and AIDS, Rwanda is one of the many countries that have a high rate of HIV and AIDS by population. So this also is one of the things that can impact the mental health of Rwandans who are impacted. The other thing is gender-based violence as well. We are also one of the countries as well who have a quite rate of gender-based violence. We can also talk about mental illness stigma. This is the Rwanda side. Coming here in Canada, I think some of the things that we often see as a challenge in terms of taking mental health in our community, there's also acculturation stress, means adapting to the new culture. Most of us, we come from Rwanda. Our faith are impacted when we switch from religious practices, different beliefs, practices, from food to many things, culture shock. This really impact our self-esteem, can trigger even depression and anxiety or other things. I think I touched base on poverty. There's also family separation, and I appreciate Dr. Lisa touching base on that one. Family separation is one of the things that impact the well-being, mental health of many immigrants, including Rwandans, especially most of the young people face loneliness, they don't have anyone to support them. And remember, we are a community that usually we support one another. We thrive by working together, by celebrating together. There's also language barriers. So most of us, you start working, you're speaking English, French, but then people you talk to, we can't hear you. What are you talking about? So all those things, impact our well-being. Again, mental illness stigma. But I wanted to conclude with two common challenges that I often see. There is first, which I appreciate Lisa really giving us a broad definition or understanding on intergenerational trauma. I often see I'm interested in finding ways, and I think this is a call also for Humura, and I like that you brought someone to give us that testimony, which is what's so amazing, because the gap that we witness between different generations, when I say different generations, I think Western cultures name that millennials, Gen Z, all these things we hear. I don't know if you have such terms in Rwanda. However, most of the time, every generation tends to try to change the other generations in terms of their approach on how they care of their mental health. For example, we see the millennial generation, we are always complaining, all the family members, they don't understand us, they don't help us in terms of healing from trauma because they don't get us. But my experience with working, I've been practicing for a short period of time. I'm a psychotherapist qualifying. However, I work closely, especially through our nonprofit and other organizations, to see ways we are impacted. What I've seen is that the goal between the two generations or different generations shouldn't be to change how others view how we care for our mental health, but the goal should be understanding each other. I'm going to give an example. For example, generations above the millennials, they have the way of expressing love, family love, a culture, all these things. And for us, the millennials or Gen Z, it can be like, this is strange. This is not the right one. You have to change. However, and I think my colleagues can testify in their practices, it will be difficult to try to change them. One thing you really start understanding as you start practicing is that the older generation, you cannot try to change their mindset. Because the thing is then the younger generation, are we trying to change how our elders view things, or we are trying to understand other ways they show us care, love, and support? For example, for my parents, although I don't have them, but someone who have parents, maybe showing you love might be serving you food. Asking for forgiveness might be cleaning your bedroom. For us, the millennial, I want you to be able to say, I am sorry. What if they can't say it, but they can show it in another way? So I think that's one of the way, bridging the gap between generations will be so important. I often say we need to organize even conversation that will bring different generations together, try to understand each other without the need to change each other. The other thing is, maybe I will conclude on this one, is I think we've been seeing some of us that follow the work in Rwanda. I'm very fascinated, and I believe all of us continue to do the work here because we want to impact our community. We've been seeing the conversation about the excessive drinking in the community, and I believe it's not just in Canada, it's Rwanda as well. And more I observe it, I always, every article that come out, I'm like, oh my God, let me read. But I'm always like, something is missing, because we are focusing more in terms of having conversation around mental health. I think what's missing in our community, we focus more on coping mechanism rather than touching the root, the root of the problem. So what I mean is that let's talk about, the hashtag less means let's drink less. So when we see the drinking problem, I've been in Rwanda recently for a few weeks, and I remember having a conversation with people. They were like, I wonder if there was no alcohol in Rwanda, how the government was going to handle people. Because alcohol is our biggest coping mechanism, and we are the church as well. People either go to church or either go to bars. And I was like, maybe the campaign or the conversation have to be different in terms of talking more about stop drinking. How about we talk more about trauma-informed care? How can we really bring the whole community the way we have approached maybe the gachacha, the umuganda, all these things we do that bring us together. We learn new approach that help our community. Maybe we have to start actually organizing, bringing people together, maybe teaching trauma-informed care in our community, because I think the conversation is not about, although it is important, but the healing of trauma is the biggest conversation we need, more than just promoting the conversation about reducing the drinking part. So I think, even when we look about in the Western practice, look at the name they give to different mental illness diagnoses. It's like, someone who have alcohol addiction, alcoholic. So we are calling them by their coping mechanism. And when we see things like, drug abuse, all these things, most of the time they are coping mechanisms. So when we focus on that, even with my experience losing my sister who suffered from years of alcohol addiction, major depression, I could see that every little support we got was more of like, trying to fix the problem, trying to end the issue rather than try to process the impact the trauma has done on her life. So I think the challenge moving forward, because when we talk challenge, we'll be talking about also the solution, is honestly really helping our communities to process. And I think space like this are so important. Thank you so much. Sorry I took longer. Thank you.
No, thank you, Lydia. I was actually holding myself not to be like, and I saw Lisa too snapping and say, yes, like we're in church. And I thank you for actually bringing that lens. And I was actually taking notes in things that came because you brought such a broader like spectrum of the type of challenges across ages, across everything. And from what you're saying, like it's important to be aware. So we're bringing awareness, and you just explained also the best way to how can we destigmatize what we see in mental health in a way that can help our community heal. And I also appreciate the fact that you also explain how different life events can actually impact and the importance of it. So thank you so much for this. And I want to go to the next question to Lisa before going to Bernadette, because she's going to bring there's a few aspects that I really want to just to kind of dive into. So for Lisa, in going with has said, what kind of assessment or evaluation process do you use to understand the extent of intergenerational trauma in an individual?
So, can you hear me well? You can use all kinds of different tools. You can, people can take histories, so understanding a family's past, focusing on traumatic events, but also the before and the after, because it's not all, it's not all trauma. Mental health patterns and pivotal life milestones. You can use narrative approaches. So when people when individuals or groups tell their stories, right, their family stories, and then you can sort of uncover trauma patterns there. You can use standardized tools like the Adverse Childhood Experiences Questionnaire. It's called ACE. And then that way you can look, it can bring up, it can shed light on early life trauma. And that could be sort of an indicator of broader generational narratives. You can use tools like the genogram. So that is it's a visual representation of a family and family relationships and histories. So you have like a father, a mother, and then you have, what happened to them, how many children, and they came from where, and then all of a sudden you have like a visual of that. In my own work, I rarely assess in that way, because I find that things are so, how can I say that? They're so interrelated, right? Intergenerational, historical, migration, identity, meaning, all of these issues all gather together. And so I also mistrust labels a lot. So what I do usually is to listen really hard, right? It's listening to what is needed because like getting better is a journey. It's like you say, I'm not feeling well, and then we can say, okay, well, if we worked together for a while, if we were successful, what would have changed? Well, how will it have changed? And then the person can sort of see where they want to go, and then from there we start unraveling, right? And when we're in a group, it's sort of like, let's cast forward where it's a subjective thing. What does feeling better mean for me? And then when we start unpacking, it's sort of like, it might not be what we thought. Like where we get to, in order to get to where you want to go, might not be what you thought it would be. But it's important to set an objective, and then after that, it's about listening to where there's movement, where it's stuck, what helps, right? And it can be, you can access it from body, from story, from mind, from all kinds of different. It can be medical, right? It can be like a pharmaceutical. You use whatever is needed to help go from A to B. Yeah.
Thank you, Lisa. And I like how you actually put emphasis that it's different for each person, and you just adjust to the difference and the nuance of an individual. So thank you for this. And I want to go to Bernadette for our next question, talking about assessment. As a psychotherapist and as a psychopharmacologist, how do you determine which treatment to recommend to the client, and what are some of the differences between psychopharmacology and therapy?
Thank you, Diane, for this question. And also I would like to start by thanking the Humora Association for organizing this important discussion. This first question came very well placed following its fund of knowledge that we learned, and also Dr. Ndejuru and Lydia, because they touched on what's needed in order to understand what a person is experiencing, what we see. A very good assessment, trying to figure out what's going on. Although trauma, there have been a lot of work, a lot of study to really understand this illness. And you might have one symptom, you might not have a full diagnosis, but you do a good evaluation, you try to understand what's going on, and you have a number of symptoms, a number of what you see, how a person is presenting to you in the office, to the world in general. And it's important to have a very good understanding. If we're talking about genocide against Tutsi, like I was 14, I'm also from Rwanda, I was there. And I know what it's like to really hear when the radio is calling to go kill people. So what a person experience or think or feel during that moment might be different from what a soldier who's asked to go serve somewhere in Iraq might be feeling. So first, you have a good understanding what's going on. If you're working with an adolescent who maybe come from a generation of a parent who didn't have treatment, who didn't have the ability to have their proper attachment, maybe have more avoidance symptoms, you are likely to understand what it's like. And in order to determine which is going to be appropriate, it has to do with the symptoms you have in front of you. Lydia did talked about substance abuse. That's something, it's what we see. The symptom is what we see. It's what usually lead the person to seek for treatment and what keep a person from functioning. Sometimes a person might get by, especially if you find yourself busy, and by the time that time comes, you are no longer able to function. That's when they present. So a good assessment, a good evaluation, a good understanding of what sort of trauma, what it means for this person, how is avoidance presenting to someone who's a genocide survivor might be different from how we present to someone who has other trauma related symptoms. So we see what we have. So if you're working with someone who's highly functioning, maybe they struggle a lot with shame and guilt, you might choose a form of psychotherapy that is going to touch on that. If you have someone who struggles with the substance abuse, a lot of treatment out there. If the symptoms are very severe to the point they are not, the person is not able to function, you cannot ask them to maybe engage in a form of therapy that requires for them to concentrate. That if a person has debilitating severe symptom that are keeping them from getting out of bed, keeping them from functioning, you might choose to go the route of medication to help them, to help alleviate those symptoms so they can do the work that needs to be done in order to work on those symptoms in a much more effective way. I think the most important to have a good assessment, to have a good understanding. Although trauma, there has been a lot of work, you can group symptoms. This person might have more avoidance symptoms, more re-experiencing, more depression, but how depression looks like here might be different. So once you know what you're working with in the severity level, then it will help you determine which form of treatment. It could be therapy only. It could be a combination of medication. It could be, let's see if a person can start with a medication, get them to the level they can function. Then you can really recommend for them to have therapy that is going then to touch on that. I think that's the answer to the question.
Thank you, Bernadette. And I keep on taking notes, and I like how, because from what you're saying, it's like meet the person where they are, and also the fact that there's like what their level of functioning will also impact like the type of treatment and approach that you will be using. And there's different approach. And just also kind of following with what you have explained in terms of some type of treatment that might be work. One of the things that I've seen is a lot of reluctance for some treatment, and most particularly medication. So I know that many Rwandan may be reluctant to use medication for their mental well-being. So how do you address the stigma that exists around medication? Because this is something that's very, very present within our community. So I would like you to kind of explain a little bit more about that.
Another good question, and I would like to start, although our focus here is for our community, this is not a stigma that is not only isolated to our community. As we can see, as the internet is growing, mental health is now getting a little more, people are open to talk about it, but people are still slowly, you might hear someone talking about depression, or some, even those celebrity we look up, although highly functioning, like people with a role model who might say, you know, I had to go to couples therapy, I had depression. It's starting to be, people are starting to be open to having this conversation. But medication, we are still there's still a big stigma. For many different reasons. Sometimes a person might say, well, if I use a medication, maybe makes me look weak, it's a quick fix. And then usually what I say, if I see this person I might be working with, I will say, would you say this to someone who needs inhaler and they have asthma? Would you say this to someone who comes to you with elevated sugar, but you have a medication that can help them maybe lower the sugar while they are working on maybe changing lifestyle? Or if someone has a high blood pressure, there is a medication that can help them. What makes mental health a bit more complex and complicated is it's often subjective. You cannot see it, right? It's the wound we don't see. And but a very good evaluation and a very good knowledge of what this medication is going to be targeting. And it's talking about maybe it's going to affect my personality. I'm going to turn into a zombie. You say, would you choose being motivated, now energy, difficulty concentrating, not being able to hold a job? What's going to likely affect the whole self-esteem and the personality versus? So it's all about what symptoms we are targeting, but a lot of education, a lot of knowledge that yes, there could be some side effects, but it's usually pros versus cons. But what I personally like to focus on is the same way we have embraced the treatment with these other medication for something such as a high blood pressure. Hoping that we can get there when it comes to mental illness as well.
And I think, and Lisa, I'm actually going to go to you, and just to kind of add to that, to what you're bringing, Bernadette, which I think is very important. Medication is one aspect and one part of that can be kind of a multi-dimensional of treatment. So, and I like that the fact that you actually brought up the education. So to ask questions also maybe about the medication and what it used, and having that understanding. And from what you're also saying is like it can also you can have different side effects, but it depends and it varies. And we're having this discussion about some of the treatment and more medicalized like approach, but and like you say, the different layer, and I think Lydia and Dr. Lisa have mentioned it as well. There's different approach, and this is one amongst many. And I think that this is important to kind of bring it to our audience today, so they can understand and also not maybe as afraid of that approach. So Lisa, I'm going to go with you for the next question here. What therapeutic approaches or modality do you use to address intergenerational trauma?
I wanted to speak a little bit to the medication, and I wanted to say, like, not every medication suits everyone, right? And so, just like not every therapist suits everyone, right? And so it's, rather than thinking about should I or should I not take the medication, sometimes it's more interesting to say, okay, does this one work? Is this serving me or not? And if this is not serving me, what could be serving me? Is this work with this person serving me, or is it not? Is it getting me further, right? And so using the different tools and looking at the process as a journey, right? And you're experimenting. Healing is a practice, is an art form, right? You're trying things out because you're getting to know what works for you, right? You're getting to know you, and you're getting to know what works for you. And so it's a trial and error approach, and it's a forgiving approach, right? Like, it's not like if you stop a minute, then everything stops. No, if you stop a minute, okay, well, you can continue some other time, right? It's not, c'est jamais fini. A human is not finished until jusqu'à ce qu'ils ne sont plus, right? Anyway, sorry, to get back to the question, so I think that the approach really depends on the person or the family or the group. En Occident, like, a lot of, when we think of psychotherapy, we think of one-on-one. It's not always, it has merit. There's a lot of things that are interesting in it, and also there are other ways. There are transformative, sort of arts-based, community-centered interventions that I found really useful. But so storytelling can be very, the act of narrating personal and collective histories can be cathartic, can be not only cathartic, can be even dialogic. It provides a platform to externalize and to share experience, to sometimes share support, grief and support, and foster community understanding. I've worked with playback and theater and psychodrama, which are dramatic forms that can allow us to reenact stories, conflicts, that allow opportunity to confront, interpret, reframe maybe traumatic events, and it's a communal process, so that deepens sort of the collective healing. I put together something that I called resilience theater, even though resilience is not the favorite word. I mean, in our community, it was not a favorite word, but the idea of using these various techniques from various, there's trauma-focused cognitive behavioral therapy, that is the cognitive is about reshaping trauma-related beliefs and fostering healthier coping strategies. There's narrative therapy, the idea to redefine or restory, recreate your story, stepping away or distancing yourselves from trauma-centric narratives. There's family systems therapy. So then you can focus on the dynamics, the patterns within a family system that perpetuate trauma responses. There are cultural or community-based interventions. EMDR is a really, really interesting method where you are recalling traumatic experiences and sort of undergoing bilateral sensory input. So you're sort of disrupting or regulating your nervous system while you're desensitizing your nervous system. There are all kinds of, there's somatic experiencing, which is very, very interesting, that are more sort of body-centered types of therapy. There's all kinds of there are all kinds of ways to get at it. Writing is really, really useful. I mean, we could go on and on and on and on. The thing is, you take one that works for you. It doesn't, there's not one that's better. You find a person that you like, if we're talking about in terms of therapeutic, you find a person that you like, that you can invest with trust. And then when if this thing feels interesting, try it. And that will take you somewhere else, and will take you somewhere else, and will take you somewhere else. What you're doing always is working on your own story, right? It's not outside, it's inside. And it's not really inside, it's in between. So it's the relationship to things that needs healing. To things, to people, right? Like Kuba ho kubana. To be here and in time and space, and to be with, right? Those are the, anyways, voila.
Thank you, Dr. Lisa. And I like how, and I think all our panelists have mentioned it, it's like there's no one treatment that works. Is different one depending on where you are. And I think what's important to kind of keep in mind is also it evolves. So there's so many strategies, there's so many tools. You wanted to add something? Elisa, Dr. Lisa.
Yes, I was thinking about things like ketamine or like mushrooms, these medically assisted psychotherapies that are coming up now, that are really interesting for the types of depressions, for example, or trauma that are resistant to other forms of. There's all kinds of ways now to help with trauma, with substance abuse, with depression, like deep depression. There is so much hope now to get. We have to keep, now is not the time to quit.
No, actually, if anything, and before I go to the next question, if anything, there's more strategy, there's more tools, and I like that you're all bringing the awareness of the different type of approach that you can use, because there's no, like, you can find different one that suits you. And I think one of the aspects that I wanted to mention, and you've kind of talked a little bit about it, it's like finding someone or an approach that is, or let's just say a therapist that works for you. But one of the things that's very important, and I was reading it recently, is like for your mental health, you need to feel safe. So psychological safety, I need to feel comfortable and safe with the person that is supporting me or helping me. And if one therapist doesn't work, or their approach, it's okay to actually go with another type of approach. So it's what can help you and serve you with what you need at that time. And I think going more into the type of approach and treatment that are available, Lydia, I would like to ask the next question to you, because one of the practices your organization use is storytelling program that is rooted in the Tree of Life narrative therapy. So can you explain to us what are the main tenets of this approach and what successes or positive outcomes have been observed as a result of its use?
Okay, thank you, Diane. And also, we continue to be inspired by the work of Lisa, Bernadette, and everyone doing the work to support our community in many ways. And I love that she concluded by saying that this is not the time to quit, because now there's so many alternatives that we can use to help ourselves and those around us. I would like to share one picture before I talk about this program. As Dr. Lisa was talking, that picture came in my mind. It's a picture that I often use when I'm conducting the anger management program to my clients. I don't know if I have the right to share something. Oh, I think I can. Okay, one second. Okay, can you all see this picture? The iceberg? Okay, great. Yes, when you look at this iceberg, okay, yeah, we come from Rwanda, things about snow and all of that, not our thing, but this is a good example of trying to explain some of the biggest emotions that we deal with our lives. For example, let's talk about anger. It can be maybe any other negative emotion that we might be experiencing. So the expert says when you see this iceberg, the top that you see, it's smaller compared to the iceberg that is underneath what we are seeing on top of the ocean. That means when you maybe you are in the ocean, you come across this iceberg where you're seeing on top. Underneath this iceberg, there's a huge mountain that we cannot see that was able to form this tiny iceberg that we see coming on top of the ocean. So what happened is that sometimes because most of us go in therapy, because it is so difficult to balance our thoughts and our emotions or feelings. So most of the time, one of the biggest emotions, presented emotions in our life, let's see, I'm dealing with, I don't know how to stop from being angry all the time. I don't know how to stop from being maybe having low self-esteem, so different things. So what happened is that we focus on what's happening right now, which is that big emotion. However, underneath, let me give an example maybe of anger. Underneath that anger might be trauma, it might be grief, it might be loss, it might be so many other things unprocessed that lead us to being trapped in this biggest emotion. So I wanted to share this before I share our program, just to adapt to what Dr. Lisa said, because she gave, or even with Bernadette as well, giving different alternatives in terms of medication or psychotherapist approach, is that the goal, maybe when they're sharing this might be, what are you talking about? What is this and that? The goal is to understand that if you have ever experienced, let's say, childhood trauma or childhood neglect or any form of storms in our life, it is important to really make sure that you have taken the time to process that. Because processing, I see it as a biggest key. Either you process in professional settings or community settings like here or church, or when we gather together around the barbecue, it is important to process, because when we don't get an opportunity to process, then what we see on top, those big emotions, they start really leading, or maybe leading every other decision that we are making. So I think although the conversation sometimes around mental health can be challenging, but knowing that processing is so important. It helps us to take care of all the other things that we are not able to see, that we have experienced or going on in our lives. So going back to our program, let me stop sharing. 1 second. Okay, going back to our program, it's called 365 Storytelling Program. First of all, most of our program are Beyond the Veil. When you hear them, we often use the word 365. Why? Because these are days of the year. The whole year, it's either 365 or 366. However, the conversation is to bring awareness that our well-being is not something we put on hold when we need to or not, but this is something we take care of every single day. And I like the panelists share beyond medical practice to even holistic practice. So this is why we are trying to encourage the conversation every single day as much as we can. So we were able to create this program using the Tree of Life narrative therapy. This is approved by the Narrative American Association. And two things that were so important to us, there is decolonizing our mental health practices, and two, decentralized mental health practices. Most of the time, there's always a conversation practitioner. We have a few practitioners, we have less resources. And then we are always like, what can we do to bring the services close to the people that we serve? What can we do to bring the support in the hand of many people who can help the community? So if I can start, I shared two words, decolonizing and decentralizing. Decolonizing was that, this is a program that we created, drawing from the founder and the co-developer of the methodology of Tree of Life narrative. And this, she's a psychologist and also based in South Africa. Her name is Nanzelo Cube. And we chose that practice because it was developed on the continent. When we see many practices, often they are really designed by the Western culture. I'm not saying that they're not impactful. Yes, they are. I have benefited from them and I use them for my client as well. However, it is also important that we start using often also practices that are understood better by our community, and also promoting the work of our people as well. So when we talk about the Tree of Life narrative therapy, this is a program or maybe a modality to help people who have experienced hardship and also to provide support so they can be able to step in the second stories of their lives. So I'm gonna stop here a little bit. When I say be able to step in the second stories of their lives, people like me and other people who have experienced storms, trauma, hardship in their lives, we have to understand that this is not a conversation that we can be able to find a solution in just few therapy sessions. Not only that, think about Black people, maybe North America or Canada. We continue to experience different types of trauma, either from racism, either from different things that we experience. It's not like, once I'm done helping someone, they're going to go home, all the things will be perfect. And I think in real life is the same thing. So this program, the reason why we're really, really, we saw it as something that can support our community. Our community are people who continue to experience hardship in life. That means when we talk about resilience is not about helping someone to be resilient and move on. It's about recognizing that my life is really built by two different things. What happened to me, and also some of the other things which are dreams and values in my life. That means we can be able to help someone to create a double story. Means that there is my experiences that I have, that have impacted my life, and also what's happening right now in my life. It's like, walking hand in hand. I'm gonna maybe say it in a way without sugarcoating. Maybe my trauma, I'm not gonna be able to take it away, but I can continue to thrive in life while my trauma, maybe I'm still processing it, and while I continue to build other things in my life. That means as we sit here, some of us have challenge, but at the same time, we are also sitting here listening, other ones guiding us, but we have other issues. So building a double story is like, help someone to strengthen their voice, really be able to move on with their lives by understanding that their lives is not only defined by one single story. There's a lot of things that are happening. I'm going to give you an example. When we had this program around April, this modality, it does not just help individuals, it also works with group of people, married, children, families, different organizations, and it has one of the program inside called Saying Hello Again that works well with people who have experienced grief and loss. And I remember when we were inviting some survivors to come join this program, most of the people were like, we don't want to come to talk. Everywhere we go, they always want us to talk about ourselves in a victim way, and we don't want to share our stories. When we're done sharing our stories, they see us as victims. So we have stopped sharing our conversation. And we told them, just join us. You don't need to say anything. And what we've seen, I think I'm sharing this testimony as a way to encourage you. This is something not only we can bring to other communities, and also you can benefit from it if you ever see we are launching another program starting. I remember having some of the men in their 40s, 50s, and who came saying, we're not going to say anything. I've never seen Rwandan men really crying in front of people. And I've never seen our community sharing the stories in a way that made sense to them. So this program is not about re-traumatizing people, but it's giving the ability to look at their life in a bigger picture, recognizing that there is this part of my story of what happened to me or what is happening to me right now, but there are also other things that are happening. My dreams, my values, people in my life, my gifts, my skills, my story, where I come from, my culture. So many things come together to make us who we are. I think the other thing, it's really beautiful to know how the program works as well when you experience it. I think one of the program who participant was like, I think you understand better when you're part of this. So I think maybe if anyone have a question, you can ask me. I try to explain it in a way. I think the last part I wanted to share was decentralizing the practices, that this program is not just limited to mental health practitioners. This is something that can be taught to people in helping professionals. Let's see, nurses, social workers, different people in helping professionals, and be able to support other people. So anyone in the helping profession who would like to really be trained in this program, they can always feel free to contact us, myself, our team, Beyond the Veil, and we can share with you the information, because we need this to be part of our community. We need this support to go closer to our people. Thank you.
Thank you, Lydia. And the thing, and I think Bernadette has a little comment to add to it. But before I go to you, and I like that your program, you mentioned decolonize our mindset. So it's something that you're providing, something that is more culturally competent, that actually can speak to some more people within our community. And what you mentioned, and I think I wanted to put it forward, is like reframing our story. So whatever story that you have, you provide to reframe it to a way where you achieve well-being and people can flourish. So I really appreciate that you brought that forward. And Bernadette, did you wanted to add to what Lydia was talking about before I ask you one last question? Because I think you can bring another aspect to it.
If it's okay, you can go ahead and ask the question and I'll
Okay.
piggyback with it.
Perfect. Okay. So one of the next question was like, one of the main barrier to therapeutic services in the Rwandan community is accessibility, and I think Lydia had mentioned it also earlier on. So whether financial or due to a lack of culturally competent resources, so what strategies or solutions you recommend to improve accessibility to medication and therapy within our Rwandan community?
Okay, so I would like to start by commenting, then it will lead to answering this question. And Lydia did talk about, by showing us this good illustration about what we see when we see the anger, but there is really a lot more that we don't see. So anger, agitation, and acting out, it's something that could be common with someone who has who struggle with symptoms related to traumatic experience. What we see, the way we can be each other's keeper, we will see the symptoms, we will see the anger, the agitation, we will see the nervousness, the high levels of anxiety, we will see the sleep disturbances, the depression, the suicidal thoughts, the obsessive compulsive thoughts and tendencies. We will see paranoia. We will see all of that, and we will also the substance abuse. Alcohol is very high, and including other substance abuse. That's what we see. So it's very important to take into consideration what a person has experienced directly or through their parents or grandparents, and by keeping this in mind, although let's say someone might have, and also we touch on the severity. I'm the one who always say, go for other aspects before you can consider medication. But again, if you are suffering for years, you've tried everything, don't suffer when there is this evidence-based treatment that could help. But again, we meet a person where they are. And it's very important to have a therapeutic alliance, to be able to have this trust, to be able to create a place where a person will feel safe, because Lydia touched on that as she's explaining us the work she's doing. Usually, all this treatment modality also, Dr. Ndejuru talked about, the first few days, the person tends to feel worse, digress, and they usually say it's the traumatization. I don't want to go back there. I'm doing very well. Why should I really open up the wound? That's actually the gateway to healing. Most of them, I am certified in cognitive processing therapy. The first 3 days or so, 3 weeks, or the first 3 weeks, I will see them more often, because that's when a person might have severe symptoms. So it's very important to keep in mind that what we see, there's actually an explanation to it, and I find this very helpful. To touch on the question you ask, although I've been in the United States for about 23 years. I have managed to be able to go back to Rwanda, averaging every 2 years. And it's really, really great to see the progress we're making. And I really think that when it comes to access, and when it comes to being able to have medication, being able to have access to this, I think what get in the way is what continue to get in the way worldwide in terms of this stigma, right? The pharmacies are there, right? We have yes, we every place can use more in terms of more people who are trained to do this. But I see this as the same way we are really ready to treat diabetes and depression. We are very well. We have people who can do this, but the key, we continue to possibly, in addition to the culture, Bernadette talked about that. You are taught to not talk, stay strong, wihanuka, ihangane, right? Culture might also get in the way in terms of being reluctant to have access to the treatment that might be there. There is a lot of pharmacies, right? And but something that I can add, maybe, which I think also there is a lot of, including what Lydia is doing, maybe to create an integrated, what we're doing here, we do evidence-based approach, the integration of care. If you go see your primary for a physical, it's good to do screening question, ask you and maybe touch on what could be trauma, assess quickly if you might have some trauma-related symptom, assess quickly if there could be some depression there. Also, that could also be a symptom of trauma. So by integrating this, it's no longer one specialized hospital that I grew up seeing, which was very stigmatized. I won't even say a name of it. But if you integrate this care everywhere you go, a person will be able, when they meet their health provider, they are asked these questions. And when it comes to doing a very good assessment to making sure that you coming up with a treatment that is appropriate, I believe it's a shared, when it comes to access, when it comes to being able to afford the medication, that's not isolated just to mental health. I think that's something that can be integrated in how we're approaching healthcare in general. And I see we continue to make progress, but the biggest thing we need to overcome is the stigma, but also I see mental health talk being like everywhere. Remember, you go to an ATM machine, they're talking about mental health, right? So I think we're making progress and slowly we're getting there.
Thank you, Bernadette. Thank you so much. This topic we could just go on about it. Lisa, did you wanted to add something, because before I ask one question to you all, for all of you to answer?
Yes, I just wanted to say that it's also it's challenging, but it's also a lot of fun. It's very satisfying to do inner work. Like it's a lot of, like, as in the community, I think that there's a lot of not only stigma, but there's also a lot of no, maybe it's a part of stigma, but there's a lot of, we don't want to necessarily say our stories. No. We don't, we're private people, right? And that is part of safety, right? So one of the things that we need to do is we need to appreciate what it means if we can create safer spaces for each other, so that when we this is a really, really important thing that Humura is doing today. When we speak, that we can, when we do speak in these ways, we get closer to ourselves and we get closer to each other. Like that can actually be delicious. So we should do it all the time. Voila.
I really like your comment, and I think this will actually is suited for the next question. But the next question, I want to actually ask each and every one of our panelists to answer this question from their own perspective. So I'm going to start with Lydia, and then we'll ask Bernadette and Dr. Lisa to answer the question. So you are an active Lydia, you are an active mental health advocate in the community. So what advice do you have for people who want to implicate themselves in mental health?
Yes, thank you. Very interesting question. I think there's two things. One is anyone with the passion, anyone who wants to engage in this work, I think one advice I can give to them is that this work requires more than just personal experiences, because we often see, people who have, there's also the pressure of the society. If someone has survived something, either suicide, either have experienced mental health challenges, the next thing is, I want to do an initiative about mental health. I want to start something. And I think for many, especially trauma survivors or any survivor in any way, I think there is also a removing that pressure to sharing your story as to really maybe heal the community because you have a story. It can be your personal experience, but may that not be the reason why you want to be engaged in this type of work. I want to be honest, it can be overwhelming because the need is so big, the need is so huge. However, also your story as well can be so empowering, can share hope, can really encourage others to know that there's no shame about what happened to them. And I think that's an advice that I wanted to give to someone who have experienced anything in life. You under no obligation, you have to share your story or you have to start something because you have experienced your own trauma or something. Because that's why sometimes you can see many initiatives, but then they don't keep going because the motivation was more about actually releasing or processing our experiences rather than helping others. The other thing is, 1 second, let me check my notes. I had something very, very important. Okay, yes. The other thing is the importance of collaboration. So although I shared that the work is so huge, I think anyone engaging in this type of work, it is important to open the doors for collaboration because this is not the work you can do alone. I'm going to repeat this one. I know, and I'm so grateful because I remember the beginning of pandemic, when we started talking to different founders, they were like, we don't often see Rwandan's organization, especially in the grant funding space. What's going on? And I'm so glad that now we are seeing many people starting organizations, doing different initiatives to support our community, and it's so beautiful. But one thing I want to share is that don't do this alone. Don't work alone. It is important that we really increase our partnership, collaboration. Humura has something bigger that Beyond the Veil don't have. Beyond the Veil has something that I think there's Prédigno, there's RCA Montreal, there's Kerry, there's so many things. Imagine the work that we can do if we share skills, transfer our skills to each other, share our experiences, even increasing our list of referrals. When I look at here, there are many practitioners, there are many people skilled in different things. When we can know each other, and I really commend Humura. I've attended different conference from Humura. I think not only within the Rwandan community, you always even go beyond the community to really search for all those support for the community. So I think 2 things: don't be pressured to start this work because you have experienced something. Second, really know that partnership, collaboration, this is the way to building the community we want. And lastly, when we do this work, I don't do it with people because I love them. We do it because we need each other, because I've seen that the impact of trauma in our community, there's lack of trust, there is so many things, and I understand where we come from, but we have to understand that belonging in a community, we are really, really high advocate of community in Beyond the Veil. The community, the good thing about it, this is a guest who came to our podcast. It's called Gen 365 Podcast. When we're talking about building the community we want, this young man said, when it comes to belonging in the community, being part of the community, it's not because we like each other. It's because all of us have the right to belong in it. It's not because our small group, our people that we like, all of that. We have to understand that what do we need? That's what matters. It doesn't matter if I'm a friend of Diane or if I'm a bestie with Bernadette. That's no matter. What matters, what do we need? And then let's build the community we want. Thank you.
Thank you so much, Lydia. And I think I like the fact that you brought, there's different type of voices, and the fact that you also mentioned don't do this work alone. And kind of just to add to this, and I'm so happy to see that there's this message and there's more initiative, there's more talk about it. And I think maybe Dr. Lisa can actually add to that, because I remember a few years ago, like even almost 20 years ago, when some of us, and I think myself and Dr. Lisa talking about mental health, we were kind of received as to the alien. So I'm happy that now we can have this conversation, and there's more things out there. So I really like that you put emphasis on that, on how to get more people involved. And I will ask the same question to Bernadette. What advice do you have for people who want to implicate themselves in mental health?
Thank you for this question. I would like to start by saying, if a person is already thinking about it, that means already they know that there is a calling, they are created for this. It's more, what's the motive? Do you like this? Do you find yourself really being able to be the shoulder for someone, being able to do this work? And then if you want to pursue it with a certain goal, you can go for it. But most of the time you find yourself doing it, and you already know. So what I can say, as you're advancing in this, very important to have self-awareness, very important to consider your therapy of your own, so you know yourself, you know what triggers you, you know the child in you that needs healing, and do the work for that child. Because once you start working with people, that's the moment things might start showing up. And if you don't have self-awareness, and if you had some therapy, you might need to do some tune-up. Self-care is very important. So consider that you might need to do therapy in order to be able to have this therapeutic alliance with someone, to be able to create a trusting environment, to be able to really exercise empathy in a way that is going to be very effective in working with the people. You might do this on a one-on-one setting, you might be in group therapy, but there is moments where you might find yourself triggered or just exhausted. So it's very important. Self-care, self-awareness, empathy is important. And that's some of the tips I can give. Yes.
Thank you, Bernadette. And I like that you also mentioned your own self-awareness. And I remember that when I started studying psychology, one of the things that say each psychologist or therapist need their own therapist. So, I like that you actually mention it, because even doing this work, you need to also check in with your own self, with your own well-being and own mental wellness, mental wellness, and it's to continue as you go. So it's never ending. So thank you, Bernadette, for bringing that forward, and for Dr. Lisa, for you answering the same question. What advice do you have for people who want to implicate themselves in mental health?
I think everybody is already implicated in mental health. You don't not have a mental health. We all have we all have a psyche, and so it can be as little or as much as the person wants. I mean, it can be a practice of one's own, be it a writing practice, let's say, or it can be something that is done in community. It can be something where you facilitate something. It can be an hour a week, an hour a month. It can be a vocation. It can, I think that the most important thing is to listen to oneself and to honor what is true for us, and to even if you are excited about it and you do it, and then sometimes you are tired, well, then listen to that part too, right? I mean, it's not like therapists burn out all the time, right? Social workers burn out all the time. Helping professionals burn out all the time. So it's not super sustainable, right? And I think that when Lydia was talking about not going it alone. I think that is something that is so important. I dream of therapeutic communities, right? Like just because we can create common language and support. There's a lot of things that don't need expert. I think there's a lot of things that can be done at a community levels that go beyond sort of, there's active listening, but then there's beyond active listening, there is emotional nervous system regulation, there is behavior change, there's all kinds of things that can be learned and practiced together. And it's not mystical. It's very concrete, right? It's very specific. And so, and it's, I always think it's fun, but then that's my own personal bias. So, yeah.
Thank you. No, it's okay. There's more. Actually, we do have some question in Q&A, and I wanted to. I'm gonna try to wrap it up a little bit so we can have the chance to ask some of the great question that we receive in our Q&A. But going with that question, I wanted, before we go to our Q&A, I actually wanted to mention for everyone who's in the audience, there's if you want to actually get involved, and there's a form that will be shared in the chat by the Humura Association. So we invite everyone to complete the form for the Humura mental health program that they are building. So we encourage everyone to fill that form if you are interested in getting involved. If the topics and you already find yourself to be kind of a natural, want to help more and advance on the topic, feel free, and so you can contribute. So there's that form that will be shared in the chat. So I want to go over actually looking at some of the questions that we received in the chat, and the first question that I want to ask, there's one question. I'm sorry, I'm looking at it. There's a question for, I'm going to start with a question for Lisa, Dr. Lisa, and then a question for Bernadette. So the question for Lisa: is it important for an individual or a community to embrace their trauma in order to heal from it?
There's a woman, I'll give you, there's a woman who once, she's a survivor, and she was going through every commemoration, she was going through it. And at one point, she reached out, and we were going to start working. And then she said, you know what? I remember that there was a woman, there was a young woman back in the day in '94, and she was shot, and she received in balle near her spine, and the doctors decided not to operate. And I was like, okay. And she said, today she's in university and she's doing amazing. And so what I had to understand was like, you know what? Yes, I said I wanted to, but I don't want to touch it. I don't want it to move. And if the person doesn't want it to move, we need to respect that. We need to respect the speed, the rhythm, if it's not now, we can't. Trauma is something that happens when something is too big, and on subit ça. We are at the effect of something. And so one of the things that is really important is that the people who have experienced it get control back. And they get to decide absolutely at what speed, what gets released, when, how. Nobody should be forcing anybody to say anything. That being said, I think that there is something around, I think that there is something beyond the work. When you work through something, there's something else on the other side. But nobody should be allowed to tell you that you must when it's your process.
Thank you. Thank you. And I keep on calling you Lisa. So Dr. Lisa, thank you for sharing this. And like you said, no one should force, and it depends. And I like that you brought that story as well to kind of illustrate everyone goes through their own process, right? The next question from the Q&A, and I will go because we are we're extending a little bit of our time here to allow a few questions. So the next question is for Bernadette, and I think this is a question that's very relevant, and we touched on a bit during our discussion. How can we address a substance abuse issue in a loved one?
This is a tough one. The way we can address a substance abuse issue in a loved one is one of the approaches we use in working with someone who struggle with a substance use related disorder is its motivational interviewing approach. What it means is you have to really motivate the person from moving from one stage to another towards the recovery, the preparation, being open to seeking the treatment they might need. But even if, okay, I'm talking from a professional standpoint also, just if you have a family member, what it means is you can't push them, you can't force them. You need to create that environment where they feel like, most of the time people who struggle with this, they already know it's a problem. Probably they have already tried to stop. By the time now they're doing it to just even feel normal, the least thing they need is to say you have to stop, go for treatment. But if you create an environment that it's usually you might ask them questions. So what happened when you drink? And they touch on the positive aspect. And then, is anything you don't like when you drink? Okay, sometime I ran out of rent money, or and it's a conversation. It's just being able to be with them in a way they don't feel judged. Yes, sometimes it might require certain rock bottom. Sometimes it might require for a family member to set ultimatum, because one of the sign of someone who's struggling for substance use is to see the damages it will cause. You might lose relationships, you might have a physical health issue. So that might really, it doesn't matter if the person is not ready to stop, they won't. But again, sometimes if they face that moment where they see that the consequences are now getting to the severe aspect, that might be the moment they step out of denial. But the simplest way to answer this is don't be judgmental, listen to them, and also protect yourself. The codependency can come in. Don't feel like you need to cater to that. I think those are some of the aspects that I can share when it comes to working with someone who is struggling with substance use.
Thank you, Bernadette. And like you said, this is kind of a heavy question too, because there's many aspects. And I like the fact that you mentioned don't be judgmental. And I think Lydia had also pointed out a little bit about it. It's like substance abuse is a symptoms of something else. So I think like to help us be less judgmental is just seeing as substance abuse as a symptoms of something else, and so that we can hold the space or support or help the way we can. So I wanted to kind of add to that. And so we have another question because we're kind of short a little bit on time, and I want to take the time to ask this question from our Q&A to everyone, and I will let our panelists answer who wants to go first after. So the question that we have is like, can trauma make us more vulnerable to exclusions and marginalization? So I would want all our panelists to comment from their point of view and maybe add a little either tool, solution, and what you see as from this question. So who wants to go first? I think Lydia, would you want to answer that question? Can trauma make us vulnerable to exclusion and marginalization?
Would you give me a moment? I'm processing the question.
Yes. So anyone else? Oh, Lisa, Dr. Lisa.
Yeah, so one of the arguments, for example, that people like in the Indigenous community, I'm thinking about Dr. Kathy Richardson, and she has a practice that she calls response-based practice, and she refuses the whole language of trauma because it's been used so many times to make it seem as though people are not weak, but like unable or damaged, or like that kind of narrative. And so they use this idea of response-based practice rather than any of that language around trauma. There are people who have been accused by, let's say, partners that trauma makes them unfit to parent. People have been accused by partners that they're unfit to be parents. Employers could see trauma as being something that is a risk factor for an employee. Of course, all of these things are part of it, right? And yet, I mean, even if this is so, I think that there is still something to be said about trauma. So the idea of response-based practice is that rather than having the onus be on the person who's carrying the pain, that it should be on the people who are at the origin of the pain, right? Because in trauma, like the violence was visited upon a person, and then it's the person who we're looking at, rather than saying this violence came from somewhere, and that is where the problem is. So it's a very different way of looking at things. That being said, I still think that there's something about the idea of trauma that helps us speak to the struggle, right? Because the struggle is real, and having sort of ways to access that is really, really useful, can be really useful. So it's not one thing, it's a multifaceted thing. And can it be used? Of course it can be, and that's why you have to feel safe, right? You have to feel safe I think that that is also why it's important to be in community, so that people can speak, you know, on you're not alone. People can speak on your behalf. You have people that can, you know, refer. People can speak, say, hey, this person, we know this person, right? We know this person, and this person can stand. So there are very real risks, and also there is a lot of well-being to be had on the other side.
And so I thank you, Lisa. And I would like to ask Bernadette and Lydia, do you want to add to this question? Can trauma make us more vulnerable to exclusion and marginalization?
I can add everything Dr. Lisa say. It makes so much sense, and also keeping in mind that someone who has experienced trauma might be having guilt, shame, and but anything that look like that would be even much more bigger impact. So I just wanted to add that shame and guilt itself is a symptom, and if anything that look like, you know, marginalization, exclusion, we might just reinforce that, you know, maybe something is wrong with me, I don't belong, I shouldn't, and I needed to add that as well.
And because Lydia, I want you to actually
Yes.
take the time to add to it, but I also have another follow-up question for you
Okay.
after, if you allow me. So I want you to add to this question, but also how can you break the cycle of intergenerational trauma in your family?
Yeah, thank you. Okay. Yeah, so to contribute to the question you first asked, I think I'm always fascinated on ways our brain work, on ways our brain process things. And I know my colleagues have more experience than I do, but one thing I know is that trauma can impact our nervous system, and how we really process stress or other things can be different from how other people who have not maybe experienced trauma process things. So maybe trying to give a picture, for example, to essential part of the brain. Let me maybe give two. There's different part of the brain. Let's think about what we call the emotional center, the amygdala, and the thinking center, which is the prefrontal cortex. So one supports the part that really process, let's see, decision making, our thinking, all of it. The other one about our emotions. Anytime we experience a stress, anytime we experience anything threatening, the emotional center will be the one really highly activate. So imagine for people who have accumulated so much trauma in their brain, means that over the time we are mostly working or making decisions mostly on the emotional center part. Means that when we face any stressful situation, the part of the brain, most of them, including the thinking center, will go to support the emotional center so they can help us to in the survival mode. And this is how most of the time we respond based on things we have learned from a primary caregiver, from the community, ways we respond to trauma. Most of the time, it's things we learn from others, especially primary caregivers or the community or people around us. So when you ask a question like that, I think also Bernadette touched based on that, and Lisa as well, the way we are going to react if we are not able to rewire our nervous system, which is possible through therapy, through different approach around there, we are going to be more vulnerable to different issues, situation in life more than other people. I think one person say, let's see, for example, use an example of marriage. One argument in the marriage can look normal, while for one spouse can be like, oh my goodness, what is happening? To taking things to the extreme level, while for other people it can be less extreme. So I think those are the way trauma can impact our nervous system, can really make us more vulnerable to handling life situation, making decisions. And I think doing the work in trauma healing work, when we start doing being aware of our triggers, being aware of our triggers, so we can learn how to expand even our oh my goodness, I'm missing that word. Okay, just knowing our triggers can really help us to start really rewiring our nervous system, balancing our thinking and our emotional center, starting to really responding to stress in a way that can balance the both parts so we can make better decisions. The last question you asked, would you please remind me, please?
Yeah, so how can you break the cycle of intergenerational trauma in your family?
Thank you. First, awareness, I think, is the key. I think awareness is the key. We cannot break the circle if you have no idea what is happening or the previous. And I think that can be another story, especially many people in our community have lost many family members. So it is so hard when we talk about understanding our family dynamic. I remember even, I think Lisa said, using genogram in therapeutic settings. I remember when I was doing one, I was like, what do I put here? Maybe after grandpa, I have no idea after that. I don't know anybody. So it can be difficult. However, I think family also for us, for our community, can mean many things. Sometimes it cannot be family by blood, but it can be people who become family along the way, people who adopted us, people who welcomed us in the community. So I think the key is to build self-awareness of your family. What are the major issues in our family? How my family respond to conflict? How my family over the time maybe manage finances, how my family maybe in terms of relationship, marriage, do we have maybe a high rate of successful marriage? What's going on maybe in terms of maybe we can even go neurological development. We see some of the families that can even have maybe genetic mental illness in the family. I think, breaking the circle really would be one to really come to the realization that the awareness of where I come from, it does really, really help me to determine where I go. I think there's another thing that I always tell, especially people who are dating. This is a good example. Sometimes people in relationship are like, oh, it's me and my partner. We don't need our family. I always tell them, whether you like it or not, your future marriage and family, your family that you are refusing to learn and be part of it, it's going to be part of it whether you like it or not. So I think really the awareness of our families, not only just negative side, let's also look into what works in our family. That can be values, that can be beliefs, that can be maybe things our ancestors practiced that we think that can work in terms of breaking the intergenerational in our families. Because we have all this knowledge, science, and everything. However, we also have the holistic approach that has been working in our family that we can use in healing our family and empowering our families. Thank you.
Thank you, Lydia, so much. And
thank you. Somebody said window tolerance. That's the word I wanted to use. Thank you, Krista. Thank you so much.
So thank you so much for answering this. And I want to, because I know it's time and I'm starting to see the time we've already extended. And before I kind of give back the mic to Humura, I wanted to actually just to add to that something that Lydia mentioned. Like we're talking about breaking the cycle of intergenerational trauma, and I think with this whole discussion we were able to present and speak about on intergenerational trauma from so many aspects, so many angles, providing you awareness, education on what's available out there. And I feel that all of us and everyone who's listening to this, you can all be kind of an agent of change in breaking the cycle of intergenerational trauma. And if I can use myself as kind of, that was always, for me, breaking the cycle of intergenerational trauma has been kind of the intention and the purpose, and to even engaging in this work and working in the field of psychology. And I feel, and I invite everyone who has been listening, and our like, thanks to our panelists, everything that you've heard today is tool, strategy, and something that can help into breaking the cycle of intergenerational trauma. So thank you all for participating in all the information and knowledge that you share. And I want to, and it was very much of an honor to kind of have this very important discussion. So I will now turn on, give back the microphone to Ryan Muhimakazi, who's the mental health coordinator for Humura. So Ryan, to you.
Thank you, Diane. Can you hear me?
Yes.
Thank you, first of all, for giving me the speech. So as Diane said, I'm the coordinator of the Humura Mental Health Program. And in this capacity, I would like to thank the people that made this panel discussion possible and this whole meeting possible. Je veux d'abord remercier Bernadette Muhimakazi Bugingo pour son témoignage et pour son courage et sa volonté d'avoir donné un témoignage pour notre communauté. I would like to thank the panelists, Dr. Ndejuru, Lydia, and Bernadette. You have all touched on the idea of creating therapeutic communities. And I think it's very important to acknowledge that you came here as panelists on a voluntary basis. And the only thing you could gain from this is just to help the community and to show us the way of what it looks like to create these communities, to give your time. And you're all leads of your own organizations. So as Humura, we pledge as a small thank you to always open our arms in terms of if it's resources that are needed, if it's manpower, if it's just help in any shape or form, we are more than you're more than welcome to ask us to come and to help as you have today. I'd like to thank our MC, Diane. Thank you so much for giving us your time and on a Saturday again, and for making the discussion so lively and so insightful. I'd like to introduce the two other people who are on my team who are instrumental in making this panel possible. It's Pasha Badeye and Krista Damadje, who are both here. If you want, you can see them. They have been very helpful. The three of us have been working for the past couple of weeks in making this panel possible, and they are just as instrumental as I was to making this happen. I will reiterate our invitation, and the Google form will be put again in the chat for anyone who's willing to help, anyone who's willing to join this team in any capacity. We do not ask for huge time commitments, but we just ask that anyone in the community who's willing to help and who has that desire to join our team in any way possible. And if it's not our team that you can join, please join any of the teams that are led by these wonderful women here. As long as it's something in the community and you can give back a little bit to our community and to help create this awareness that we're seeing more and more, we would be extremely thankful for that. We thank all the people that came today again on a Saturday afternoon with everything that people have to do in life. We're eternally grateful for everyone that came, and we thank you very much.
Thank you, everyone.